So it's day 4, almost day 5 for a genioplasty patient. You can let me know in case it's hurting you, yeah? The scan has been taken for you, right?
Noted.
A post of CBCT has not been taken?
Noted.
Good so far? Not feeling too much?
No.
Okay. Okay. Just get this straight. I'll start with the other side now. This pull is hurting. Okay. Look a little up. You're being very patient. Okay. We will show on the previous. Okay, yes, you can have a look at yourself. The sticker mark will fade off, okay? It's just the Genioplasty which was stuck. So you can have a look. Also, you can compare with your previous picture. That will be a good comparison. So when he came, it was a short chin, short both vertically as well as horizontally. And you were very clear that you wanted the chin more pronounced, one that suits your face basically. Also, not to forget, we did buccal fat removal as well for you. So it was a jaw which wasn't more defined and has been given a shape right now. The marked change will be on the side view or the profile view. So we can see the side view once. Okay, yes. So this is now which will show the most marked view. So this is a profile view. So when you draw a line, look a little towards your left and you draw a line from your forehead along your nose, upper lip and the chin. You see that the chin was way retruded or receded inside. So it was not matching the facial proportions. But now you have a chin which is so called manly. It is more pronounced now. The swelling will go down. Yes. Yes. The lip muscles will relax a little bit. It's all tight right now. It's a contracture stage is there. It will all loosen up because there's a lot of tightness right now because of the fullness, recent fullness that you have got. It will all become more natural and ease out, so as to say. Also, as you rightly mentioned, you see whenever the chin is receded or anything is receded, there is no tension in the skin. By tension you mean a good stretch is not there. So there is no good stretch. You see the jaw line is not as defined as it is now. Once obviously the sticker marks goes and complete healing happens, you will see that your jaw has a good contour now. Yes, exactly. Right? The best part is it's a jaw surgery which is being done intraorally. So the stitches are all intraoral and it's spical which is resorbable. Yeah? You can compare the other views as well. Yes, even from this view, this 3/4 view. You can see it's more defined. Even someone can have a look. Yes. It's okay, you can come a little front. Yeah? So the chin which is more pronounced now. Not only horizontally but vertically as well. He wanted the maximum possible has been done. Little bit of swelling, tension is there, that will ease out. Yeah? I'll show you other views as well. So 3/4 view. It will ease out. Yeah.
It's a bruise, right?
Sorry? It's a bruising. Bruising why? Because with the stretch, the suprahyoid muscles also stretches. So anywhere that the blood gets, it's kind of an ecchymosis. That will go away. You can see on this view as well. You turn to your right. You can even appreciate this view. You can appreciate that you have a jawline which was masked earlier because of the skin which was lax. Right? You should like the change because
I will find. My